Hi, I'm Susan Noyes, the founder and chief visionary officer of Make It Better Media Group. Welcome. Thanks for joining this live event, watching our show online afterwards, sharing the outstanding advice, articles, and fundraising opportunity that will follow, because you will be helping to save lives too, just by participating. Because fentanyl is now the #1 cause of death for all 18 to 45-year-olds, it is imperative that everyone learn more about this crisis and help to keep our children, our other loved ones, and communities safer. In honor of National Fentanyl Awareness Day, May 9th, we present this panel of experts to provide you with outstanding advice too. Our 4 experts are Jan Blum, founder with his wife Irina of the Linus Blum Memorial Fund. Their 15-year-old son Linus died last year by taking one pill that, unbeknownst to Linus, was laced with fentanyl. Their fund also works with the nonprofit Song for Charlie, which was founded by similarly grieving parents. We also have Dr. Lisa Kugler, Vice President of Shatterproof Treatment Atlas, an addiction assessment, locator, and treatment platform that is now available in 45% of the United States. Emma Roberts is the Senior Director of Capacity Building for the National Harm Reduction Coalition, and Lindsay Ellers, a psychiatric social worker for Lurie Children's Hospital in Chicago. This event also is a fundraiser. Your donations through the Make It Better Foundation will be matched by our foundation and the Linus Blum Memorial Fund, and 100% of those proceeds will be given to our National Fentanyl Awareness Day partners, Shatterproof, National Harm Reduction Coalition, and Song for Charlie. This video will be included in MIB TV, on our YouTube channel, and in Better.net article summarizing the top-line advice from our experts today. Please send your questions for our panel through the chat feature during the live event and to editorial@makeitbetter.com afterwards. Also, please see outstanding advice in these articles already online at better.net. So, it is never a pleasure to introduce a grieving parent, but it is a great honor for us to work with Jan Blum to help prevent similar loss going forward. So with no further ado, Jan Blum.
Thank you, Susan, and thank you, Make It Better organization for making this event possible. It's a really important topic, as Susan mentioned, and we really want to be saving lives that have been tragically taken away by fentanyl. As Susan said, I'm here in the capacity of a grieving parent, and so my child Linus was actually killed by fentanyl poisoning in the year 2020, and he was just basically going into his senior year. This was the summer, and you can see in the picture how he's full of joy and hope, and the whole life in front of him. And I'm here today to share the sad story of Linus. We've also set up foundation with my wife, so the fund carries my son's name, so it's called Linus Blum Memorial Fund. And what we're hoping to do is really raise awareness both at the local level in the Bay Area, where we're from, as well as nationwide around this terrible crisis. So I'll tell you a little bit about Linus and his personality and character. He was a funny, sort of a quick-witted young man who always made a lot of friends wherever he would actually set his foot. He had struggled with addiction issues in the last year or so, before his tragic passing away. But in the photo that you just saw like a couple of moments ago, he was full of hope, and he saw a future ahead of him there. Linus was actually an incredible athlete, and in the last couple of years, when we'd actually moved into the United States back in 2014, and he quickly started to do wrestling, and in fact he did really well. He was ranked 6th in his weight class in the state of California, the year before he passed away. But I think what also was sort of affecting him was the there was a lot of pressure academically to do well, and that's pretty typical, in this day and age. That's the pressure, the type of pressure our kids are feeling, every day at school. And there was also a lot of peer pressure, and I think we'll be talking about that later on during this panel as well. But he did start to kind of experiment with drugs in high school parties, and in the final year, we started to see signs where, like he was struggling with his substance abuse problem. And for us as parents, we saw these warning signs and flags, and of course, tried to do our best to help him, recover from his addiction issues. What we didn't know at the time was that 2020 was a really bad year to be having a bad year. And so I hadn't heard about fentanyl. And in fact, the year when he passed away, we saw a huge increase in the county of Santa Clara in terms of, fentanyl deaths, and especially youth and young adults were disproportionately impacted by the crisis. Fast forward 11 days from the photo that you saw moments ago. We were at home. It was the summer, and we were wondering, why hasn't Linus woken up? And we went to look him up in his room, and he didn't show signs of life. And of course, we were panicking and called the 911. And paramedics came over. They tried to resuscitate him, but it was too late, and we had lost Linus forever. That night and the day and the night, it's all hazy, and I don't have many recollection of like the events that happened, but the police did immediately say that they suspected that Linus had actually passed away because of fentanyl-laced drugs. And then in the months that ensued, when the police started to find out more about what had actually happened, we later learned that he had used a Snapchat to find a dealer who actually brought the pills, couple of blocks from our place, and that's where they met. And Linus bought what he thought was Percocet, but it ended up being a fentanyl-laced pill, and that's how he lost his life. I'm sort of I do want to finish soon because we want to save some time for the discussion as well. But I just want to share a couple of takeaways from the story that I just shared with all of you. One of the key takeaways is just simply awareness. As caregivers and those who are looking after youth and people who are actually struggling with addiction issues, it's super important to be aware of like the sort of day and age we're living in right now, and how fentanyl epidemic really has changed the nature of street drugs. And so laced pills and then fentanyl laced drugs are like very prevalent, and it is a Russian roulette when you're actually using drugs that are actually bought from the street. The second takeaway is that it's not just awareness, but also how do we kind of communicate in the right way with our, let's say, teenagers. It's a very, very difficult thing, and during teenage years, parents are typically the last people that they'd like to receive advice from, and so I'm not saying that it's easy, but it's super important to be able to establish these lines of communication. And then we just need to be vigilant, be aware of signs, and then trust our instincts. If you have a child that's actually struggling with addiction issues, so typically they might want to even deny that they are having addiction issues. And so how do you trust your instinct as a parent or caregiver and then provide the support that your child might need? The last thing is there is a powerful drug called naloxone. And the FDA actually recently made it available as an over-the-counter medication. So you no longer need a prescription, and this is a drug that actually very effectively can reverse an opioid overdose, including that caused by fentanyl. So just wanted to call that out as a preventative measure, and it's something that every family could actually have available at home. That's it. Thank you for listening to my story, and I'll hand it over to Susan at this point.
Thank you, Jan. It is not easy to tell that story, and it is so important that you share it. And I know you shared it at schools and on TV stations in San Francisco. And anything we can do, we're here to help, and you gave us great advice. Next, I'm delighted to introduce Dr. Lisa Roberts. Dr. Lisa Kugler, the Vice President of Shatterproof Treatment Atlas. She actually has great experience developing another mental health platform before this. So we have a terrific expert ready to share good insight with you now.
Thank you so much, Susan. And thank you everyone tuning in today who is really learning how to fight this scourge that is threatening so many individuals within our community. My name is Dr. Lisa Kugler. I'm a licensed psychologist in Pennsylvania and so happy and proud to be representing Shatterproof here on Make It Better. Shatterproof is a national nonprofit who was formed to really transform the substance use disorder space. Our founder and CEO, Gary Mondell, lost his son to substance use disorder about approximately 10 years ago. Shatterproof is really aimed at reducing stigma, changing the treatment landscape, and empowering and educating our communities on the dangers around substance use and addiction. Three things I'd really like to leave you with today, but first I'd really like to start with some statistics. First of all, there is 109,000 fatal overdoses this past year. That's 12 fatal overdoses every hour. If this was any other chronic disease, there would be extensive supports available. There would be integrated health records. We would be able to see and track it in real time. And unfortunately, there's not. Part of the reason for this is stigma. And one of Jan's story is so powerful. And what I'd like to let everyone know who's watching is that you are not alone in this crisis. Stigma keeps all of us silent because we start to feel ashamed of who we are and what we know around substance use and addiction. Up to 60% of an individual's traits, including predispositions to substance use disorder, are based in genetics. That means that 40% are environment, parental skills, etc. So this really leans on recognizing that there is a genetic predisposition. It's just like asthma, diabetes, etc. And we really want individuals to feel supported as they go through this. It's very sad whenever the general public is polled and 90% of the general public stated that they did not want someone with substance use to marry into their family, or that they thought that it was okay that 64% of employers deny employment based upon a substance use disorder history. This is the time for us to change that. We must speak out. The other point that I'd like to raise is, once again, you are not alone. With 12 overdoses every hour, all of us have been touched by this disease. If you are feeling very alone, I encourage you to find a group. There's local recovery organizations, there's national recovery organizations. Shatterproof.org has a walk that occurs. We have multiple walks in multiple cities. Please come out. Please find out you're not alone, and please find those supports for yourselves and your loved ones. The third thing I'd really like to mention is don't lose the hope and the gratitude. I can say, and I've been working with individuals with substance use disorder for multiple years, people do recover. If you or a loved one is looking for treatment, I strongly recommend coming to treatmentatlas.org and looking to find that high quality care that will work for you and your loved one in supporting your recovery journey. with gratitude, optimism is sustainable is one of the quotes that I recently heard from a television interview with Michael J. Fox, who was dealing with his own disease pathway with Parkinson's. Substance use may have many stops and starts. It is a chronic condition. And there's something about knowing it in your head, but then really learning it in your heart and being able to be present with that individual that may have substance use, being able to support them through their challenges, and being able to be there as they have their really great days and also in those struggle moments as well. So thank you all for raising awareness. Thank you for being willing to come to the show today. And thank you for tuning in and doing your part to change the landscape of addiction.
Lisa, thank you for outstanding advice, and thank you for the platform that you have built to connect so many people who don't have to be alone and can find treatment and support too. Your comments also really reminded me that it's not just fentanyl that we're fighting. There's, and it's not just fentanyl overdoses. So it's just fentanyl has sort of raised the alarm because it's so insidious. But your advice rings true for all addictions and treatments. Now, I look forward to introducing you to Emma Roberts. You will hear a very charming British accent, but please know that she is based in New York City and Puerto Rico and is the Senior Director of Capacity Building for the National Harm Reduction Coalition. Emma. Oh, you're on mute. You're on mute.
Sorry, trying to keep the noise of the dog out. But thank you, Susan, for inviting me to be a part of this conversation. And I'm really grateful to be in this space with these amazing people. Thank you, Jan, for sharing your story with us. It's a story that we hear all too often in our work at the National Harm Reduction from families, and also to my colleagues Lisa and Lindsay. And Lisa, I really want to commend Shatterproof for the work that they're doing on stigma, because I think one of the biggest things we know from our work is that stigma is actually a part of what's killing people, because they don't feel able to come forward and ask for help. So my journey in harm reduction started in the mid-90s in the north of England, when heroin became highly available in the communities that I was working in my city. I went on 8 months of maternity leave. Yes, in Britain, we get 8 months of maternity leave, not 8 weeks like in the US. And I came back to find communities that were very impacted by the sudden increase in the availability of heroin. And many of the families that I was working with at that time and the young people that I was working with were suddenly either impacted by their own drug use or somebody else's in their family's drug use. So this was in the mid-90s. And once you learn harm reduction, and you get to understand the spirit of it, which is basically an approach to substance use that is not necessarily hinged on abstinence. If people want abstinence as harm reductionists, we support them to get there in whatever pathway they choose. However, we also support people that might not be ready or might not want abstinence to help them stay alive and stay healthy. So, and I remember when I first started, I was very questioning of that approach for myself. I was like, holy smokes, am I enabling people here to use drugs? But I very quickly learned from seeing what was happening in the communities I was serving. And then when we started to provide syringe service programs and other harm reduction services, how the importance of that connection. And I read one of the stories that were shared here with you, the story of Betsy and Charlie's story, right? Betsy lost her son also to a fatal overdose. And she talked a lot about that importance of connection, right? And one of the sayings that I love in this work is a saying by Johan Hari, who's a British journalist who did a TED Talk, and my wonderful colleague Brittany is going to drop the link in the chat for you. It says, everything you know about addiction is wrong, right? And he talks about his own family journey, that basically he learned that the opposite of addiction is not necessarily sobriety. The opposite of addiction is connection. And that as human beings, when we are connected, we are much more likely to be healthier and safer. But traditionally, what have families been taught to do, right? We've been taught that when our loved one is going through problematic substance use, we should cut them off and let them hit rock bottom. And many of the families that have come to us in the Harm Reduction Coalition have told us, if only we'd known about harm reduction, if only we'd known about naloxone, which is a harm reduction intervention that we have been promoting as harm reductionists for decades, right? But only recently are we now being given much more wider access to it, including the over-the-counter options that Jan spoke about. They said, they'll say, if only we'd known about harm reduction, instead of letting my, rock bottom for my loved one was death. And dead people don't recover. So, the messaging we try to put out there alongside colleagues like, Lisa, around, challenging stigma, promoting connection, being able to foster those conversations, especially with young people at a time when they feel, Jan, your story really resonated with me too as a mom, right? I'm a mom whose own teenage son experimented with drugs. And what we learned was part of that was he was struggling with very severe seasonal affective disorder, which was affecting his mood and depression. And he's also a young man of color who gets racially profiled, and the pressure of that, that led him towards experimenting with drugs. And luckily, as a parent, after I kind of took myself in a corner and gave myself a talking to, because of course, you want to go into mama bear mode, right, to protect your child, I was also able to bring in the tenets of harm reduction and the philosophy to use to really foster the conversations. And when we get to the questions part, I can speak a little bit more about that. So a couple of other messages I want to raise at this point in the 1 minute I have left. One of the things that we noted as a panel is that we're all white folks here, right? And so also recognizing that in America in particular, but around the world, the experiences of people who use drugs, and especially young people who use drugs, who are people of color, and my own son's experience of being racially profiled in relation to that is very important for us to acknowledge. Because, what Black folks will say to you, including my family members, is like, well, y'all weren't really bothered about this until white folks started dying. And that's the reality that people have faced for decades in this country in terms of the war on drugs. So I think we also need to be very aware of the race. In the National Harm Reduction Coalition, our North Star statement says we create spaces for dialogue and action to help heal the harms of racialized drug policies. That's a really important component. And another message I would want to give at this point is, how we work with children and young people. I think often young people are labeled very early on in terms of substance use that actually can drive them deeper into their substance use. They feel very stigmatized by it. So we have to also know when young people are starting to experiment with drugs, how we start to hold those conversations can play a really big part in terms of how they then go on to continue to use drugs or not use drugs, or how they continue to use drugs more safely, even if they still decide to use. So I think that's it. And I think just to echo some of the other points here, that fentanyl is not just present in opioids. It is now present in many, many different substances that young people and people in general are using. And many people who perhaps aren't traditionally using opioids are not aware of that. So the awareness that Jan spoke to is so important. It's important that this is a community-wide effort, that everybody knows about this, that naloxone is seen in the same light as an EpiPen for an allergic reaction, and that is the level of access, because even the over-the-counter options that we have right now are going to cost money. We don't know how much the pharma companies are going to charge. So we also need to make sure that people that can't afford the over-the-counter also have access to other free forms of naloxone. And Brittany, again, my wonderful colleague is in the background here, will post our naloxone finder app that you can go to our website and will help you find where is naloxone available for free in your part of the country or world. So thank you.
Thank you so much, Emma. At some point, I would like for you to actually give us the top line tenets, points of how you define national harm reduction, because I think that's a new term for many people. Your closing is the perfect time to introduce Lindsay Ellers, Lurie Children's Hospital psychiatric social worker, because Lurie works hard to provide those types of access into the free access in the community. So, Lindsay, can you please take it from here?
Thank you, Susan. Yeah, so a lot of what we do is a lot of harm reduction, and we try to get those out into the community. There is a PDF we'll provide for you of how from Chicago Department of Public Health of how to access these things and what the city of Chicago is doing to provide more access. And just kind of echoing off kind of what Emma was also saying is in the disproportionate areas of the city where they're most needed, we're really trying to provide resources such as like Narcan, fentanyl testing in those areas. We actually recently just got funding for a van so we can go around and provide these services. So you don't have to necessarily come to us, but we do provide all of it for free. So another thing, like I said, we really work on a harm reduction model. So working as a therapist here, it can be really challenging working with parents because they're thinking harm reduction. My child shouldn't be doing substances at all. What are you talking about? Like, it has to be abstinence. And so a lot of education is around that. Like, what does this harm reduction mean? Like, how do I explain to a parent that it's okay that they're using a little bit? We're trying to kind of tailor it down. Like, how do we get to the point where the patient's finally deciding, like, I'm going to make this change for myself? Like, asking an adolescent to do something that their parents asking them to do, I think we all kind of know that's not going to go the best direction. So we really need to kind of get everyone to kind of agree on what's going on and where we're at. So a lot of this is education, not only for the adolescent or the young adult, but also for the parent or whatever guardian is involved in the treatment. And so we're really kind of trying to discuss like what are some areas of functioning that we need to improve, what is going on in the relationship with the family, how do we have a better communication, and then also kind of echoing off the whole concept of connection. We need to find healthy connections, healthy activities. Like, what are we going to do to kind of further, I guess, express like what we really have going on. Like, and a lot of times that's me working with the patient on what did you used to do before substance use? What were your interests? How can we further those interests and get some healthy relationships or healthy activities that aren't revolved around substance use? And that's just one small part of harm reduction that we kind of do. So we really kind of encourage these open discussions. We also work with a lot of our patients, if necessary, on medication addiction treatment. So Suboxone, buprenorphine, and we really try to get those out in the community because letting kind of patients know you have these options. Yes, abstinence isn't the only option. And if you want to kind of work from a different perspective of medication-assisted treatment, that's also an option. And I think that's something a lot of people forget about, but it definitely can be life-saving. So like I said, we use a lot of the harm reduction approaches, just really kind of giving the option of choice. And what I've known working with adolescents for over a decade is choice. You need to give them choice. They need to have some agency in their decision making. And then also comes from the parent allowing them to kind of make these choices. And so kind of having the parents kind of rein back a little bit of that kind of need for control over what's going on with their adolescent is super helpful. Because as soon as an adolescent realizes like they're making these decisions and they're making change, you see so much more change. Treatment goes so much more fluid and can be a lot more long-term and see much more benefits. So again, a lot of this is education with both the parent and the adolescent. And sometimes it's me talking with the parent alone saying, hey, let's talk about this for a second. I know this is really uncomfortable, but what can we do? What are you thinking? And where can we go from here? So again, I should probably wrap this up, but just really kind of being reflective as a parent. What I would really encourage you to do to have these talks is being empathic. Don't be directive, like just be like understanding, like what's going on. Can we talk about it? If you don't want to talk about it, can we maybe go somewhere where you might want to talk to someone about it? So just having that open discussion that you're okay with them getting treatment if they're not comfortable talking to you about it. And that's another thing I talk about with my parents too, is like, maybe they're not ready yet to talk to you about it, but maybe they'll talk to me about it and we can see what we can do. And then maybe you'll see these small changes and eventually you're going to come into the session and we're all going to talk together as a family, and it's going to just be a whole lot better for the whole family unit in general. So that's a lot of what we do, is just kind of working with parents on kind of having more empathic views, a lot of reflective listening, and just kind of being open to kind of what are the options and what are the choices. You really want the patient to be the one who wants to pursue the treatment. They don't want to feel forced. They want to have, again, that agency, that option. And I think that's what we do, Lori, we do a really good job of, is really helping the patient see like this is their choice, this is their environment, and letting the parent kind of take, or guardian take kind of a backseat for a little bit, but then also doing some side education for them so they kind of feel comfortable what's going on and still feel like they're part of the treatment. And again, really meeting the patient where they're at and what level of treatment they're ready for. Treatment doesn't always mean detox. there's so many different levels of treatment that you really have to kind of consider. And sometimes treatment just means coming in and getting fentanyl test strips. That's fine. Come and get the Narcan, get the fentanyl strips. We're happy to provide it. We'll send it out to you. We've sent it out to campuses before for patients who haven't been on site. So it's something we do everything in our best interest to kind of get it out there, get it in the community where we can. And it's another thing, like I have parents come in that's not related to fentanyl, and I'm providing them with Narcan and they get so scared. And it's like, no, we want this in the community. We want you to be able to have it, because you never know what's going to happen with your child, your child's friends, people, your neighbors, even like maybe your adult friends. And so it's really kind of from that education standpoint of just having it in the community and knowing where to find access to it. And so that's what we do a lot here at Lurie. But I will stop now and hand it back over to Susan.
Thank you so much, Lindsay. When I was growing up, when I was a teenager, experimenting, and when as a mother, my kids, the youngest is 27. So my parents were like, "Don't do drugs, period. You're going to be grounded for the rest of your life." And I was pretty much the same kind of parent, but I didn't have to worry that they were buying marijuana or some other street drug that was laced with something as horrifying as fentanyl. So if I hear all of you correctly, parents shouldn't give ultimatums. Like, what percentage of teenagers experiment with street drugs, right? So if you could give us again the bullet points that, what percentage of teenagers are going to go do street drugs no matter what? And then your best advice for parents who are afraid of becoming enablers as opposed to maintaining connection around a difficult subject. Okay, I see lots of heads nodding. Jan, do you want to go first?
Oh, sorry. I was just going to say, statistically, I think like the highest rate is around e-cigs and marijuana. On a regular rate is around, I think, 30 to 40% of teenagers are engaging in at least one-time use, and it's a lot lower for monthly use. If you want just kind of a rough estimate of substance use among the youth, and I think that's the youth report.
And fentanyl is now laced in marijuana and what other street drugs?
I just have to correct that. The statistics show that it's not in marijuana. That is a lot of hype in the media that we try to challenge. It is laced in other street drugs, but there's very little evidence that it's in marijuana. And the studies that found it actually found that they were accidental. It was an accidental, what's the word? Like lacing. Right. It is not. It's an accident. Well, some of the stories turned out to not be accurate, and then I think there's like one or two studies or tests that found that it was actually present. It got there by accident. So I think it's really important that we don't give the messaging out to parents that routinely marijuana and cannabis products are laced with fentanyl. They're not. What we're seeing is that it's showing up in things like pills, like Jan described for Linus. It's showing up in cocaine, it's showing up in meth, and then in some parts of the country we don't see heroin anymore like we used to. We see pure fentanyl. And that's important, right? Because if you've got people that are dependent on that opioid for whatever reason, it means they don't have a choice. Right, they don't have a choice to not use that batch of and choose a batch of heroin over fentanyl, right? They, even if they do have fentanyl test strips. So also part of what we're teaching people is if you have to use, and even when you know fentanyl's present, here's some harm reduction tools. And I think, Lindsay, you did a wonderful, wonderful job of describing to parents and young people like how to apply harm reduction in our work, right? That meeting people where they're at. This is a collaborative approach. Right? We are respecting people's bodily autonomy. We are centering people, right? We are not prescribing and, telling them what they should do. We're asking them what they need and what they want to do. And, we're walking alongside them in that process, right? And giving them all the education, the tools and the options. I loved how you described the options that they can then choose to reduce the potential for harm. So, I think that, that's, and then the other aspect of harm reduction in terms of our principles, and you can see the principles, they're listed out, and we have some materials on our website at harmreduction.org, is like, we talk about being pragmatic and realistic, right? We are pragmatic that drug use is a part of the world. It's been a part of our society since the beginning of time, right? Mind altering, mood altering, physiologically altering substances are a part of the world. So we're realistic in the ways that, thank you, Brittany, for posting them. We're being realistic about how we approach it. And I think that leads into how we talk to young people. We are being realistic and acknowledging that even when young people are choosing not to use substances, they may be around their friends who are. And I often, I remember New York City Health Department asked me to go to a high school and do a session. And I'm like, I'm a harm reductionist, right? I'm not going to tell them not to use drugs. So when I got there, and one of the things that the young people really engaged with was I did a lot of third person, like, if this was your friend, right, what would you do? We used a model called the drug sex setting model, which is developed by Dr. Zimberg. Dr. Zimberg was someone who studied people coming home from Vietnam, where soldiers used high amounts of drugs to cope with the traumatic situations they found themselves in. And he then studied people coming home to see, like, why did some people stop using and why did some people not? And I think this is really important as parents for us to think about. And this is what helped me with my son. We go straight to the drug. We don't necessarily consider the set, which is the person, right? And how they're feeling, what's going on for them. Are they happy? Are they sad? Did they eat today? I know what I'm like when I'm not eating. What else is going on for them, right? And what kind of also, like, what setting are they in, right? And how are they using? Are they using with friends? Are they using alone? And also what the cultural setting is that they're working with it. So when we think about all those three factors, and I remember working with these high school children, and we use scenarios like, if you had a friend that was smoking cannabis by the side of the river because there's no adults there, what are the risks of that, right? And they're feeling really depressed, versus, oh, you're partying in your parents' basement and everybody's smoking weed, right? What's the difference? No. So being able to give young people those kind of realistic scenarios and also the options that Lizzie spoke to is super important in the conversation. So I want to let other people chime in.
So could we get back to the parent perspective? What advice do you give parents for how to have these conversations with their kids when they've never thought about having to talk to their kids about, are you going to use drugs? And if you are, this is what you should be mindful of.
One of the things that I would like to say is that start the conversations early. And I would suggest don't be afraid of them. We talk with kids about other diseases. Addiction is a chronic disease, similar to asthma, similar to heart disease, similar to juvenile diabetes. We wouldn't shy away from those conversations. And I strongly encourage parents not to shy away from this as well. And if there is understanding that genetic predisposition to substance use disorder as well, and begin talking with children about some of the potential challenges that they may have. And once again, not feeling the shame of our family's bad, or this is something that has to be hidden. Bring it out in the open and talking about it, because that could save a life. There's an old saying that we're only as sick as our secrets. And I think that that is so true, especially when talking about substance abuse. And Emma, I loved what you said about, talking about the various situations instead of a very totalitarian approach as you will not do this, looking also at mental health concerns. Is this masking something else that's going on? Is it depression? Are they feeling really stressed? Is there therapy needs that could be there? Medication assisted treatment, evidence-based practices for substance use disorder, if it has gone that far, and not being afraid to look for that treatment and being able to help someone engage in it. And as I mentioned, Treatment Atlas is available in 11 states at this point in time. Strongly encourage anyone, if they are looking for services, to visit Treatment Atlas, as it does have evidence-based services there, quality, along with really elevating the consumer voice. And patients have the opportunity to talk about what was treatment like for them as well.
I would love to hear from Jan too.
Yeah, like I'd love to share a couple of perspectives. So first one is just like I think we've thought about situations where we've had productive discussions with our kids versus like situations where maybe the child was ended up being cornered and felt like the parents are almost like pointing their finger at them. So for us, like what's worked is like looking into neutral situations, like when you're driving in a car. And it's not like you're there because you're having a conversation, but like you're doing something else, and then you're passing time. And so, what are some of those like situations where maybe it's like a kind of a more conducive situation or environment to be having a kind of a discussion with your child? And so that's been one thought that we've had. The other one that's kind of also pertinent to what Susan, like what you asked like before, like what should we do in this day and age because it's so different, and should we? What is the way forward, like in terms of like best protecting our kids? So one thought that we've had for years is like how can you look for activities where you also like open your home or you try to encourage your child to spend more time at home or closer to you, and so because that's a good way to understand like what's going on in the lives of your children, for example, and also keep an eye out on them, and so. What are some, could your home be a place where, there's a space where, your child and their friends can actually spend some time while like feeling like they can actually spend time in a private setting whereas like, on the other hand, like you're still close to your kids. So how do you look for these like ways of opening up your home and like, discovering ways of like, inviting your kids to spend more time with you without necessarily like prescribing it?
That was an issue that I faced with my kids, and my kids wanted our home to be the home that they could bring their friends to and party. And that was, for me as a parent, an easy one to say no. But I don't think that I would respond similarly now. I think the issues are more complicated.
Exactly. You want to be close to where your kid is spending their free time.
And
you were obviously a cool mom, Susan, right?
No, I was not the cool mom. I was the meanest mom in the universe, but that's okay. We all do the best we can.
Oh, sorry. I just wanted to add something to what Jan was saying, which was awesome. For me, when my son was experimenting, one of the conversation openers that I used was like, tell me what's good about using these drugs. Tell me how is it helping you? So, and then how might it not be helping you? And that we call that in motivational interviewing, which I'm sure Lindsay's aware of, and Lisa, decisional balance, right? So what's good about, and that really helped my son to be like, oh, she's not coming at me of like, really negatively. We actually explored together how that substance was helping him in that current moment, and how, because that's one of the things I say to people a lot who, many clinicians and people come to us who want to know about harm addiction. They're like, oh, teach us the theories of addiction. I'm like, I can do that, but it's not going to help you engage people, because not everybody has their own relationship with substances and their own view of it. Even people that may be genetically I can never say it, disposed to it, don't agree with that theory, right? And if someone says that to me, I don't push it with them. I don't go, oh, well, you should agree because the research shows it. I say, okay, you tell me what your relationship with is. And I did that with my own son. What was your relationship with this? How's it helping? How's it not helping? What are the risks? We actually worked out that the biggest risk for my son was getting arrested, more than the drugs itself, because that also meant, because we were on a visa, he was going to get deported back home. And I'm like, well, you're going to go live with your grandparents because I'm not coming with you. And that had a huge, that was a big influencing factor for him in terms of, but we discussed okay, well, if you're going to use, maybe don't use on a school night. Where are you using with your friends? Oh, well, I'm using in the park with my friends. I'm like, well, what if the cops arrive? Maybe think about who you're using with and where you're using and when you're using, right? And so being able to have that kind of conversation with him, really kept, to Jan's point, that closeness, that connection, that open dialogue, right? And he was able to come and talk to me about it, right? and eventually he made the decision to stop using, or when he uses really responsibly. My son also volunteered on the front desk of a syringe service program when he was doing his high school volunteering. I also think exposing him to that reality and him seeing that had a huge, so not hiding it from him, not hiding the reality of what problematic substance can look like, really helped him to decide what his approach to substance use would be as he entered adulthood. So I just want to add that.
That's really an interesting suggestion. I hadn't thought of it. That's a good one. Do you have advice for educating the community more broadly? So you've given great advice now for parents, but how do we spread the word and spread the Narcan or whatever, the fentanyl strips? How do we get everyone more mindful of this issue and how to save lives?
I would say events. Sorry, go ahead, Lisa. But I would say you need to kind of target more events where you can kind of get more mass persons around that you can just hand them out to. And I know that sometimes has a lot of stigma around it, but I think it needs to be more openly accepted. And that's just first. And go ahead, Lisa.
Lindsay, I want to capitalize on something that you said about the stigma and getting the word out there. I think the first step is actually, Jan, I so admire you in sharing your story today, because I think this is the first step, is not being afraid to be honest and open, to not keep those demons sort of hidden inside. Recovery is possible, and recognizing that recovery is possible and being willing and able to share those stories is the initial step in addressing the scourge and addressing that always thinking us, them, and it's not going to be my son or my daughter, etc. It is ubiquitous. Substance use is everywhere. Addiction is everywhere. Let's be willing to talk about it and tackle it and distribute the naloxone, distribute the fentanyl strips, and let's really work together as a community to address this issue than trying to say it's not my problem.
Great advice.
I think there's also something around, you have to look at it as a kind of a combination of national and local activities. Mm-hmm. And nationally, we have opportunities to change curriculum in schools, for example, and like bring about evidence-based techniques to talk about, harm reduction, etc. And then on the other hand, locally based activities can be really, really powerful as well. I mean, I share a lot of my, like Linus's story at local high schools, because it really touches folks in a different way, because they know it's somebody who maybe they wrestled, their kid wrestled with him or something like that. So I think there's something powerful in that local grassroots level work as well that all of us need to be doing, I think.
Jan, I would especially love for you to know that in the comments we've had, could we please share this video and content with OD Free Marin? So there's another resource that we really want to especially target.
Let's follow it, please.
I love that.
I think that Lindsay I think that Lurie Children's works hard to try to get into the community around events. I heard you say that there was going to be a bus. Would you like to speak a little bit more about that?
Yeah, we also do some school-based stuff for just parents as well as for the students, and then also for the staff. So, and it's all harm reduction. We definitely are abstinence-based education. And then we just put it out there, anytime you need fentanyl strips or Narcan, it's provided. We come with it. We also do a lot of train the trainers. So we train almost all the staff here at Lurie. We have it open to the public in different areas. We're open to all the community agencies. We offer all Narcan training for everyone. So we really try to get it out there, the training aspect of it, as well as the education into the harm reduction techniques and providing fentanyl. But yeah, and I think they're all, never mind. I'm not going to say things that aren't real yet, but there's some really exciting things that could be happening through Lurie. So just stay tuned. I don't want to say anything I shouldn't say. But yeah, so we're really working on that harm reduction on area. And yes, we're a children's hospital, but our program is specific and we go all the way up to the age of 25. So we are still working with young adults. So as they, because we know like that kind of collapse in care of aging out of kind of the I guess children to like adults. So we make sure we have bridged that gap. So we still work with them. And so, yeah, there's education in the schools. We're working on getting a van out so we can provide testing, Narcan training, and then providing all the kind of anything you would need as far as harm reduction.
I think I just want to add as well, you know, to all the points that people have made, a couple of things. First of all, in terms of awareness, like, yeah, we, you know, as someone who also, we, you know, at National Harm Reduction Coalition, we do a lot of capacity building to help programs develop, but we also work at the kind of that national level, Jan, that you were talking about. We work locally and nationally to try and drive policy. And, you know, and even at statewide levels, when we're trying to inform legislators and the people that are responsible for the systems that we have to live within, you know, that we can give them all the data they want, but it's the stories. Right, you have to have the stories, and you know, Lisa, I think Shadowproof, you do a great job of that as well. Like telling the stories that go with the research and the data is what really pushes change. I've even had some legislators, you know, even when you present data to them, they say, "Well, that's your opinion." I'm like, "No, it's not my opinion; it's data." But anyway, you know, so I think it's really important as part of awareness that we get, you know, we're able to really tell the stories and uplift the stories of people's experiences.
Make It Better believes that too. And we are asking everyone to share their story. If they have a personal connection, or at least, you know, share the post with someone, because those stories are so powerful. People can relate. This has been a fantastic discussion. Thank you very much. I would love to ask each of you if there's anything else you want to share before we say goodbye.
I had one, I mean, if I may start, so one thing that I probably didn't mention yet, but I thought I would mention it here is if you look at like the time that your child spends, you know, in different types of like, you know, online platforms and, you know, in the digital world, I think it's a really important thing for the caregiver to kind of understand, like, you know, what's happening in those places. You know, there are bad actors that are after our kids, and then, you know, being aware of like, you know, who is your child, you know, communicating with, and in which platforms, and I think that's a super important thing to be aware of. And I know it's also hard. I mean, like with Linus, for example, he always like valued privacy very highly, and then we had a difficult time as a parent. You know, you don't feel like you want to break into somebody's phone, or like, you know, like to understand like what they're doing, or somehow sneaking from behind and then trying to open their phone. But on the other hand, you know, if you are able to see what's happening there are a lot of signs. I mean, just like you see as a parent, you might see warning signs and flags in the everyday life and sort of behavior of your child, but a lot of the behavior is happening, you know, online. And so how do we establish a better awareness of what's happening there, and how do we talk about these digital tools with our kids, because so much of their time is spent there.
And there are always ways to track a digital footprint. Parents just have to be mindful of those and willing to ask for help around it. Anybody else?
I guess I'll give one little bit of advice that I've found is helpful in working with a lot of parents and teens is open communication. Like, you know, your child is probably going to go to a party. We'll put it that way. You know, your child's going to go to a party. So having that kind of open communication about, yes, parent or guardian, I'm going to go to this event, but I'm going to need a ride home, and not being punitive when you pick them up. Like, hopefully, you know, they're not two sheets to the wind, but I mean, being open about that discussion of like, what did you do there? Are you okay? And what I've found by having those discussions and kind of more of that like responsibility and accountability, is the teens are more responsible when they go to parties. They want to come home and they want to kind of be okay when they see their parents. They want their parents to pick them up. Again, this isn't across the board by any means, but simply kind of working on that kind of change and how to kind of communicate when what's going on the weekends. Your kid doesn't want to tell you everything of what's going on, but maybe the who, what, where, but not the, you know, what I'm doing. But being able to have that communication of them being able to come pick them up and not being punitive about it, not getting upset, not getting whatever, and being able to have a conversation like how to go, what was going on, like, and you can kind of gauge from that, like, how things are going. And I've had pretty good success with a few of my patients where it's like they go to parties and now they're just kind of like, I'm just gonna have my parents pick me up. And it works out really well, because previously they would just be like, well, I have to be secretive about it. Everything's a secret. Everything's a secret. And like kind of Lisa said about keeping secrets, never goes well. So that's something I really encourage to maybe have as an open discussion.
So one step further, you would recommend that if a child calls their parent and says, please come get me, and ask no questions, but keep me safe, you would say, yes, always go, and don't ask those questions.
Yeah, because I mean, it's safer than them getting into a random Uber, safer than, you don't know if their friends are not using, and then they're going to drop them off and they could be using. I mean, or they're walking home alone. Like, there's so many more unsafe ways that they're going to get home, rather than you just picking them up in the car and we can talk about it the next morning. Or maybe they want to talk about it that night. And it's not punitive, and it's more of an open and welcoming environment where they feel more trust. And when you give a teen more trust like that, it can kind of really breach a lot more responsibility in the teen, and kind of just respect towards the parent, which I feel like a lot of parents wish they had more of.
Yeah, great advice.
I just want to add to that, Lindsay, that's such a good point, because, we know in the UK, there's research that shows when we start sex education earlier, actually young people that get that and are treated with respect around sex education tend to wait longer before they first have a sexual encounter. And when they do, they're more responsible. And I think the same thing that you described there around substances can happen. The sooner we have these conversations, the more open we make the dialogue, then, young people feel respected. They just want to feel respected and affirmed. And when we do that, then it keeps that communication open, right? The other thing that I would add as a closeout is I think there's often, this push to criminalize substances. And whilst I understand that may seem like common sense to a lot of people, what we've learned at the National Harm Reduction Coalition after decades of doing this work is that when we increase the punitive approaches to substance use, we actually put the most vulnerable, including young people, in greater danger of criminalization, which can have, when young people are criminalized for substance use, that has such far-reaching effects, on their lives. So that's one thing I just, we could have a whole nother, that's a whole other topic in its own right. But I do want to raise that because I know that often, I speak to parents who are like, we need to increase the penalties for people that are dealing drugs. I'm like, well, what if that was your son's friends that gave them the drugs? Because I had that happen to a friend of mine in college, right? And that's the reality of the punitive approach. And I know that Lisa, through Shadowproof, you're often talking about a support, and there's a whole campaign called Support, Don't Punish, right? But I know for many people that can feel counterintuitive to what they've been taught as common sense. But the research tells us that every time the government increases the penalties around substance use, the number of deaths go up because people are more secretive. And also, criminalizing people has not solved this. If the war on drugs had worked, we would, we wouldn't still have it. We had decades and decades of the war on drugs. So that's the other point I just want to make here.
And I'd just like to end with summarizing what everyone's saying and recognizing, as being a parent myself, that none of this is easy. So I encourage all of the parents, please be gentle on yourself. Mm-hmm. And from your head to your heart is a very, very long journey. And it may be something that you have to kind of train yourself over and over and over again. And I strongly encourage the parents, it's anxiety provoking, it's scary, but don't allow the what ifs to take away what is. So enjoy those times with your children, enjoy those conversations, be there, be present, and be gentle on yourself. Nobody is perfect.
Lisa, that's the perfect advice to end on. Thank you very much. We all should be gentle on ourselves and more empathetic and listening well to others, including our children. Thank you to each of you for sharing your stories and your great advice. Please watch for the video to be posted online, for the articles to be posted online. They will be featured, and sign up for our Better Letters, email newsletters that go out to about 86,000 individuals now. and share the fundraising opportunity. If everybody donates a little, we can fund so much more awareness building. So thank you for great advice. And thanks to everybody for joining.